Hello and welcome to another episode of your AKT Podcast, which is hosted by wellmedic.co.uk. In this podcast episode, we will cover a dermatology scenario. Now, dermatology scenarios are often tested as image-based questions in the AKT. For this episode, we will cover a descriptive scenario, which is actually very typical of the AKT. So, in terms of our revision process, it's very easy to say, okay, I'm going to look at lots of pictures on DermNet or whatever, choice of scenario that you may decide on. The difficulty with doing that is if you don't focus on what the description is, these questions can be very tricky. So the scenario for this podcast is going to be a 22-year-old patient who suffered from some itchy erythema around her lips, extending into her nasolabial folds for 8 weeks, and she also describes multiple papules present in the same distribution. Okay, so all around her lips and into the nasolabial folds. She's tried topical hydrocortisone, which she's purchased from a pharmacy, for a week, and she's found actually her symptoms are much worse since doing that. What would be the likely diagnosis, and what is the best treatment option for this patient? Okay, so let's just think about the presentation. So the patient ultimately has itchy erythema around the mouth up to her nasolabial folds. There's nothing about gold crusting that might make you think impetigo, and the patient used topical hydrocortisone, which is another clue, and that's worsened the symptoms. So this is a case of perioral dermatitis. Perioral dermatitis is an erythematous eruption of small papules and papular pustules in the distribution which is primarily around the mouth. Now, it's very poorly named because it's not a dermatitis, and one of the etiological factors is actually the use of steroids. So if you know someone who's been using steroids for a while, that's probably not helping their symptoms. But what you want to do is, rather than getting them to stop their steroids completely, you maybe just want to get them to cut their steroids down slowly so that it doesn't then flare and bring back a kind of flare type dermatitis as well. Now, in terms of treatment, if it's a very mild case, which this one sounds like it may well be, then a topical antibiotic is completely reasonable. So, you've got topical clindamycin, topical erythromycin, or topical metronidazole. And in other patients where it's more severe, then you'd want to use a systemic antibiotic. So, a 4 to 6 week course of a tetracycline. So you've got oxytetracycline, which would be 500 milligrams twice a day. Or you've got limacycline, 408 milligrams as well, and then you've obviously got your obvious choice of erythromycin, which can be 500 milligrams twice a day as well. So I hope you found this useful. We're going to now move on to another scenario. Thank you so much for listening, and please do share this with your peers. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.